Massage Therapy Test Prep Mock Exam and Study Guide, 25 Key Questions. Question 1. Which muscle is known as the boxer's muscle? Latissimus dorsi, serratus anterior, pectoralis major, biceps brachii. The serratus anterior is called the boxer's muscle because it is responsible for protracting the scapula, which occurs when punching. Question 2. What is the primary action of the SCM, sternocleidomastoid, muscle when both sides contract? Lateral rotation, neck extension, neck flexion, shoulder elevation. Bilateral contraction of the SCM muscles flexes the neck, chin to chest. Question 3. Which of the following is a contraindication for massage? Mild muscle tension, acute inflammation or fever, chronic back pain, delayed onset muscle soreness. Fever and acute inflammation are systemic contraindications as massage could spread infection or worsen the inflammation. Question 4. What does effleurage mean in massage therapy? Kneading, gliding or stroking, percussion, friction. Effleurage is a French word meaning to skim. It involves long, gliding strokes toward the heart. Question 5. Which joint is a ball and socket joint? Knee, elbow, shoulder, glenohumeral, wrist. The shoulder and hip joints are the primary ball and socket joints in the body, allowing for movement in all planes. Question 6. What is proprioception? The ability to feel pain. The body's ability to sense its position in space. A type of muscle cramp. A massage stroke. Proprioception is the sensory information that tells the brain about the position and movement of body parts. Question 7. A client presents with frozen shoulder. What is the medical term for this? Bursitis, adhesive capsulitis, tendinitis, kyphosis. Adhesive capsulitis is the medical name for frozen shoulder, characterized by stiffness and pain in the shoulder joint. Question 8. Which layer of the skin contains the blood vessels and nerves? Epidermis, dermis, stratum corneum, cuticle. The dermis is the true skin and contains nerves, blood vessels, hair follicles, and sweat glands. Question 9. What is the main purpose of cross-fiber friction? To warm up the skin, to break down adhesions and scar tissue, to induce sleep, to improve lymph flow. Cross-fiber friction is used to realign fibers and break down adhesions in tendons and ligaments. Question 10. Which muscle is the antagonist to the biceps brachii during elbow flexion? Brachialis, triceps brachii, deltoid, coracobrachialis. The triceps is the antagonist, opposing muscle, to the biceps during elbow flexion. Question 11. Which nerve is compressed in carpal tunnel syndrome? Ulnar nerve, radial nerve, median nerve, sciatic nerve. The median nerve is compressed as it passes through the carpal tunnel in the wrist. Question 12. What is the term for a muscle contraction where the muscle shortens? Isometric, concentric, eccentric, passive. A concentric contraction occurs when the muscle shortens while generating force. Question 13. How many vertebrae are in the cervical spine? 5, 12, 7, 9. There are 7 cervical vertebrae, C1, C7. Question 14. Which system is responsible for the fight or flight response? Parasympathetic nervous system, sympathetic nervous system, endocrine system, digestive system. The sympathetic nervous system prepares the body for stressful situations, fight or flight. Question 15. What is lordosis? Abnormal lateral curvature of the spine, exaggerated inward curve of the lumbar spine, exaggerated outward curve of the thoracic spine. A type of bone fracture. Lordosis is an excessive inward curvature of the lower back, swayback. Question 16. Which massage stroke involves rhythmic tapping or striking? Petrie's sage, tapotement, effleurage, vibration. Tapotement includes techniques like cupping, hacking, and tapping. Question 17. What is the primary function of the lymphatic system? Pumping blood, filtering waste and immune response, digesting food, gas exchange. The lymphatic system manages fluid levels, filters waste, and is a key part of the immune system. Question 18. Which muscle is part of the rotator cuff? Teres major, supraspinatus, trapezius, rhomboids. The four rotator cuff muscles are sits, supraspinatus, infraspinatus, teres minor, and subscapularis. Question 19. A client has a bruise. What is the technical name for this? Edema, hematoma, erythema, atrophy. A hematoma is a localized collection of blood outside the blood vessels, commonly known as a bruise. Question 20. What is the term for toward the midline of the body? Lateral, medial, distal, proximal. Medial means closer to the midline of the body.